Good morning, everyone. So nice to see you after 4 years, right, in person. So we used to meet every year, sometimes twice a year. And I've seen many of you over Zoom. So nice to see you in person again. My objective today is to assess the progress we have made in California and compare it with the national figures. A major report came out in 2021, so I am going to show you how well we compare with some of the national statistics. I have a lot of slides. I want to cover in about 15 minutes. Okay, there we go. So when we met in 2015 for the first time, so people started asking me, what's your vision? So I said, I want to make California the healthiest state in the nation. So in terms of disease prevalence and in terms of utilization of preventive services. So I'm going to share with you some of the figures and you can judge. So 2 decades ago, Surgeon General David Satcher released the Surgeon General's report examining the nation's oral health. So in 2021, the National Institute of Dental and Craniofacial Research released the follow-up report titled Oral Health in America, Advances and Challenges. So the report has put out calls to action and very specific recommendations regarding many things. Here I highlight policy changes, collaboration, and then diversity of the workforce. So there have been many advances over the years. NIDCR has supported many of these research projects. Many of these research to understand the link between oral health and systemic health. AI can generate greater diagnostic accuracy, improve workflows, and transform surgical processes using robots, imaging, using it for 3D printing, creating crowns and bridges on the spot, teledentistry, minimally invasive dental procedures, implants, tissue regeneration, and affordable smart toothbrushes, one of my favorites, and more. So how all these advances have impacted oral health. So let's take a look at some of the statistics. So we have seen many reports linking infections in the mouth to systemic diseases. CDC has supported several collaborations between oral health and chronic disease programs. For example, in Maryland, they implemented hypertension screening in dental offices and identify patients and link them to a source of dental care. In Colorado, they supported diabetes screening in an FQHC setting and for bidirectional referral. And we have also participated in a couple of HRSA-supported efforts to integrate oral health care during pregnancy, during prenatal visits. So there have been many efforts at the national level supported by CDC, HRSA, CMS, and NIDCR. So looking at chronic diseases and oral health, so what change in the prevalence of lack of functional dentition, that is about 20 teeth per person. The other way, what we see is the percent with functional dentition among all these different chronic disease groups increased from 56 to 68.2%, except in one particular group, those with rheumatoid arthritis. Otherwise, every group saw improvement over time. And loss of teeth, all teeth, among 65 and 74-year-olds, we have seen tremendous improvement over time. And here is statistics about children, percentage of poor children, 2 to 11, 12 to 19, with untreated dental caries. So we have seen improvement over time, especially among poor children. Untreated disease among 2 to 5-year-old declined from 20% to about 10%. So marked improvement. But the most disappointing news is that tooth decay itself didn't decline. In other words, treatment rates went up. The tooth decay, here I'm showing 12 to 19-year-olds, children with at least one decayed missing filled tooth. The prevalence or the severity, that's the number of cavities, didn't change in the last. This contrasts with what happened in the 70s and early 80s. Over a period of 15 years between 71 and 87, tooth decay among 5 to 17-year-old declined dramatically, and everyone expected that decline to continue. And some people predict that tooth decay in children will no longer be a public health problem in the 21st century. But that didn't happen. So what we see is profound, not only that tooth decay didn't change, but also we see profound disparities. So how well California did during this time? So we started, we were using this data from 2006. Among third grade children, 71% had tooth decay and about 28% had untreated tooth decay. In 2000, this is the California Smile Survey conducted in 2004, 2005. So at that time, we had one of the highest rates in the country. We were in the bottom, I think second from the bottom. And also use of preventive dental services in general, especially among the medical dental program. As you can see, there was a big difference between the national rate that was at 46% in 2006 compared to 36 or 37% in 2013. So that led to many efforts in California. This is a report released by the California Dental Association, phase strategies for reducing barriers to dental care in California. I'm sure some of you who are sitting in the room participated in crafting this. And looking at the recommendation, although the report was about access to care, the number one recommendation was to establish this state oral health leadership and optimize existing resources and to focus on prevention and early intervention for children. And then, of course, to innovate the dental delivery system to expand capacity. And then this report, Little Hoover Commission report that came out in 2016, I'm sure, again, many of you were instrumental in making this happen. Even before this report was released in 2016, the Department of Healthcare Services had started working on initiatives to transform the system. So there was the Dental Transformation Initiative in 2015. And of course, the California Department of Public Health initiated the 10-year prevention-focused state oral health plan. So the commission at that time believed, by the time the report completed, believed both initiatives represent significant opportunity for California to do better by the population it serves. So we released the disease burden document in 2017, the state oral health plan in 2018, and the surveillance plan in 2019, and started gathering data, conducting surveys. So here is the data on population served by community water systems in California. So we see a big increase from 2006 to 2020, from 27 to 57%, but we are well short of our target of 70% by 2025. So the national target is around 74% or so. So what about tooth decay in third grade children? As I said, we were in the bottom. In 2006, we have seen improvement over time. So a 10 percentage point decrease in caries prevalence, while nothing changed at the national level. So everything is moving in the right direction. Untreated tooth decay declined, and dental sealants increased the use of preventive services. So, but we see profound disparities, both, geographically, race and ethnicity, and the socioeconomic disadvantage. So this is based on our third grade survey of about 12,000 children. As you can see, it varies from 45% to 76% in Central Valley. So we are focused on eliminating these disparities. And interestingly, when it comes to the use of preventive dental services, sealants, actually there are no disparities at all. So this is very good news. So how do we compare with the national statistics? As I said, we were in the bottom. Most of the states were doing much better than California. So we asked Centers for Disease Control. Dr. Kathy Phipps is here. So she was able to get the data for us. When you look at, this is difficult to compare, but gives you some good idea about where we stand. As I look at this one, actually we're doing as well as nation as a whole now in 2020. So whether it is caries prevalence in third grade children, untreated disease, or dental sealant prevalence, although the demographic characteristics of California are not all that favorable by looking at the percent of Latino children. How about adults age 65 plus who have lost 6 or more teeth? Again, actually, California is close to #1. So we're doing very well with respect to this indicator. And when compared to some of the tobacco states like Kentucky, West Virginia, where the rates are 3 to 4 times higher. So this is a national leading health indicator, one of the subsets of the Healthy People 2030, dental visits. And this is where we are. Proportion of people 2 years of age and older who had a dental visit within the last year. So we are tracking very well. There was a dip in 2010 because of the recession, I think, in California. And then now, actually, we are almost there or a little bit higher than the national statistics. But there are disparities when it comes to dental visit utilization, both among the adults and children. Where the gap is narrower when it comes to children because of ACA and all those efforts to provide dental care to children. If you look at adults, the difference between privately insured and public is, almost 48% to 25%. So now going back, utilization of dental services in the Medi-Cal program, CMS published this infograph. It increased from 2000 to 2019 and a dip because of COVID. So it increased from about 29% to 52% nationally. And California is tracking it. The only difference is California's rate started going up since 2015. We're almost there. But when it comes to utilization of dental services during pregnancy, we are not doing well. So our data shows about 44% and didn't move from 2009, 2010. And we see profound disparities by insurance type, age, race and ethnicity, and education and poverty. So a lot of work to do when it comes to improving oral health care of pregnant women. So many organizations, many have advocated for medical, dental, social support system integration. So as part of the CalAIM, there was a work group working on integration efforts, bringing together dental, medical, behavioral health, pharmacy, and social support services. One of the major barriers is electronic healthcare, record system. So Direct communication through the electronic health record systems is not easy to, and therefore coordination of care is very difficult, especially for those who have chronic illnesses. So many insurance companies have embarked on efforts to integrate. Aetna, Cigna, United, they're all focused on, for example, diabetes population, where there are some very good data showing that there can be cost savings. And here in California, the health plan of San Mateo dental plan for Medi-Cal members that's fully integrated with medical and behavioral health care benefits. So if that is successful, this could be a good blueprint for additional integration efforts in California. So, so this is the message from the three authors of the Oral Health America report, Dr. D'Souza, Francis Collins, who was the head of NIH, and Surgeon General Dr. Vivek Murthy. To substantially improve oral health throughout the United States, policy changes are needed to reduce or eliminate social, economic, and other systemic inequities. Oral diseases are preventable, and social and other determinants of health need to be considered in prevention and treatment strategies. Policymakers must make oral health care more accessible, affordable, and equitable. So the key messages from this report: oral health must be regarded as integral to oral health and should be embedded in the broad framework of whole body health. Community conditions like poverty, literacy make it difficult for families to engage in healthy habits, use community level and individual preventive level interventions, and access treatment promptly. Accordingly, the social and commercial determinants of health need to be addressed. And lastly, the separation of dentistry from overall health care has led to systems of oral health care financing and delivery that limit access to care and perpetuate disparities in oral health. So addressing these broad challenges will require leadership, advocacy, and ongoing efforts to develop policies, programs, and systems. And these should remain priorities for achieving oral health improvements for the entire population, both at the national level and state level. Thank you very much.